All right, everybody, I'm gonna go ahead and start. Hey, is there lights back there though? Sorry, it might get darker than you guys.
If I turn them all out, I apologize.
Are you guys gonna be all right? Is that okay there? Can you guys see?
Oh, here.
Oh, you did.
Yeah, there you go.
All right.
Let me turn them down, sorry. Is that okay?
Good.
Okay.
All right. My name is Dr. Buzz Korth. I'm founder of Troy Physical Medicine and Rehab and Buckeye Physical Medicine and Rehab. We're a chain of facilities located across Ohio where we have medical providers, physical therapists, chiropractors, and massage therapists all functioning together, specializing in musculoskeletal, regenerative medicine, and anti-aging. A couple things before we get going tonight though. Number one, make sure your cell phone ringers are shut off. I just checked mine. And another thing is, I'm going to stay as long as I have to afterward to answer questions, but if we hold questions until the backside, I would appreciate that way, because a lot of times I don't answer the information as I'm going through. Okay. I mentioned that we are a multidisciplinary practice. Last year we saw right about 80,000 patient visits total, and we did, so far year to date, we've done almost 300 stem cell procedures. I myself am diploma trained in anti-aging and fellowship trained in stem cells. So is Dr. Sophia Bainin. She is our medical director. So I have a lot of information I want to share with you guys tonight. But I think before we get talking about, number one, has everyone here heard of stem cells? Raise your hand if you heard of stem cells. That's what you hear, right? And if you're here, you're probably thinking baby stem cells might be able to help you, and the answer is maybe, but I'm going to go through that tonight. But I think it's really important, before we start talking about stem cells and other regenerative procedures, you really have to understand how you got to where you're at, to understand how stem cells or other regenerative procedures might be able to help you, okay? So I want to talk about how do we get messed up? Why are you guys sitting here tonight? You know, and there's two categories of reasons why. And those are controllable things and uncontrollable things. So what are some controllable things that we've done to our body that's caused it to wear out over time? Well, extra body weight, poor nutrition, lack of exercise. If you haven't had these things, or maybe you've been overweight, or you haven't exercised your whole life, that will lead to your back and your knee and your hips and all these different types of joints hurting. There's stresses, improper biomechanics. Maybe you're a school teacher bent over all day long, or you worked in a warehouse lifting boxes, or maybe a truck driver. It's really hard to have proper ergonomics all the time, and this also leads to the breakdown of your spine, you know, in your different joints. And then we have endocrine issues. As we get older, our bodies lose testosterone, growth hormone, and estrogen. And when this happens, our bodies break down quicker. You know, and these are all things I consider controllable. We can all diet, eat properly, and exercise, and you can take bioidentical hormones to prevent these from breaking down, right? And then we have the uncontrollable things, and these are the fun ones. Car accidents, slips and falls, sports injuries. Has anyone here had any of those things? Pretty much everyone, right? And usually it's a combination of the two things, controllable and uncontrollable things, are why you're sitting here, okay? And what you have to understand here is, what is degenerative joint disease, or how does degeneration occur? And are you suffering with degenerative joint disease? Well, what you have to understand is pain is inflammation. So if you have pain somewhere, you have inflammation somewhere, okay? And chronic pain, so pain for longer than 3 months, is degenerative in nature, a degenerative condition. So if you had pain in your knee or your back or your shoulder or your neck, you've had it for longer than 3 months, you are suffering with a degenerative condition, okay? And with degeneration, it works the same way, whether it's your knee, your back, your hip, your shoulder, or whatever joint it is. So what I'm showing here is a knee, but like I said, it could be any joint in the body, and this is what phase 1 degeneration looks like. So right away we know this person's had pain for at least 3 months. And what happens with that chronic pain is it starts to wear out the cartilage. And we have cartilage between all the joints in our body. And that cartilage is basically the shock absorber between the bones. The thinner it gets, the less shock absorption you have, the more stress you have on the joint. And then the one thing we know for sure is, if you have phase 1 degeneration and don't do anything about it, what do you think happens? Always goes to phase 2. So what's the difference? Here's phase 2. So right away what you notice is there's less cartilage, so less cushion. And with phase 2, the other thing that happens is, because you have less cushion, the joint actually starts to derange. You start to stretch out the tendons and ligaments. So you can see in this situation here, the bone's starting to slip to the side, which affects the functionality of the joint, which speeds up the degenerative process. And if you have phase 2 degeneration and don't do anything about it, what do you think happens? Goes to phase 3. What do you have here? Well, here, you know, this is what they say, bone on bone. Well, if it's really bone on bone, the joint won't move, but you're close to bone on bone. Little to no cushioning at this point, so the bone, because of the pounding, starts to get these outgrowths. You know what those outgrowths are called? It's arthritis. You start to get spurs and arthritis, right? And as you can see, the ligaments become more lax. Usually at this point here, the joints popping and grinding and making all kind of crazy noise. We know that's not good. And we know if we don't do anything here, it goes to phase 4, and that's surgical. That's a knee replacement, a back fusion, a shoulder fusion of some type, or major surgery. So the whole point of the lecture tonight is to try to avoid getting to that phase 4. So what are your options? Well, you could do nothing, right? But if you do nothing, what's the outcome? You're gonna have surgery. So doing nothing is choosing to do surgery. Okay. There's physical therapy, chiropractic massage. We do all that at Troy PMR and the other offices. And these are very effective in the beginning stages. So when you first get injured, that first 3 to 6 months, PT, chiropractic massage are all very valid. But as time goes on, and you get to phase 2 and then deep into phase 3, they do become less effective. Medications, there's a pill for everything, right? And I'm gonna go into some standard medications tonight. Surgery, you just replace it, right? Fix it, use it. But I think everyone here would agree, a surgical joint, a replaced joint's never the same as what you had. Never. And this is where regenerative medicine comes in. And this allows some people to turn back the hands of time. So what are typical medications? Well, when you first have pain, which we know is inflammation, typically what people do is they'll take an over-the-counter medication, an NSAID. NSAIDs stand for non-steroidal anti-inflammatory drugs. These are over-the-counter. I can send my 11-year-old boy into CVS. He can go in there and buy these, so it must be safe, right? Not so easy, right? Well, if you turn the, this is a 1,000 count one here. They have bigger ones at Sam's Club, I think. But if you turn the bottle around, the first thing you notice on the back, don't take more than directed. And do not take for longer than 10 days unless directed by your physician. Well, why would that be? It's over the counter. It should be safe, right? They sell 1,000 count. It's got to be safe. What happens with NSAIDs, taking long-term, cause gastrointestinal problems, kidney problems, and liver problems. Last year alone, it was the 16th leading cause of death in the United States. The FDA estimated last year 20,000 people died from taking over-the-counter NSAIDs. So if you guys get one thing out of the seminar tonight, if you're taking Advil, Aleve, Tylenol on a daily basis, it's not if, it's when you're gonna have a problem. And I'm not here to slam medication tonight, we prescribe medication. But you can't take it for chronic pain. What other options you got? Muscle relaxers. Now these are behind the counter, so we know there's a little more risk here. Soma, Flexeril. The reason they're behind the counter is you can become addicted to these medications. That leads to dizziness, drowsiness, change in vision. And the thing we don't like in orthopedics is these long-term will affect your balance. A lot of people who come in with hip fractures and torn rotator cuffs because of falls, when you do their history, you found out they've been on muscle relaxers for a long period of time. It affects their balance, okay? So once again, NSAIDs are fine for short term. Muscle relaxers are good for short term. But if you're using it to treat your chronic pain for longer than 3 months, it doesn't make sense. Opioids. A lot of you hear about the news this late, you hear this in the news every day, right? Opioids, we know they're bad, right? Tons of side effects. You know, seizures, constipation, fatigue, decreased sex drive, it messes with your endocrine system. But the big thing is they're habit forming. Last year in the United States, 33,000 people died from prescription medication overdose. We're not talking about heroin. These were prescribed by physicians. And I just saw on the news last month, this number is 25% higher at this point. What they did is they went through death certificates and they found that 25% of the people that said overdose, when they looked back, it was actually opioid overdose. So the number's even higher. Okay? We work with lots of children and athletes. There's a huge problem in the high schools at this point with opioids also. And you know where the high school kids are getting opioids, right? So not only does this not make sense to take for chronic pain, there's nothing healing in this. If you have this medication in your house, it's your responsibility to make sure it doesn't get into the child's hand also. Cortisone injections. Who's had a cortisone injection here? I got that. I had one myself. Cortisone's old-fashioned medicine. I said I've had one myself. Lots of side effects with these, and I always ask people when they come in, if you're only allowed to get 3 per year, do you think it's because it's good for you or it's bad for you? Yeah, any more than 3 would be medical malpractice, okay? Why is that? Well, it messes with your immune system, you can get cataracts, but the big thing it does is cortisone destroys the joint. It weakens the tendon, ligament, and causes osteoporosis in the joint, okay? I know this firsthand. I played college football. I got injured. I got a cortisone shot. I didn't know what I know now. And I have to be honest, I felt better 3 days later. It was a miracle. I was like, this is the best thing ever. A month later, I tore my pec. Tore my pectoralis muscle. Why? It weakened the tendon and ligament. Okay? So, and this is the only conjugation, we're gonna talk about stem cells in a little bit. The only thing that would prevent someone from getting stem cells other than they don't qualify is if they've had cortisone in that joint. Because when you put cortisone in a joint, it kills everything in the joint, even your own stem cells, for the next 6 weeks. Surgery, you can always replace it, right? You know, obviously there's risk with any type of surgery. Infection, this is a crazy stat, 1 in 400 people have total knee replacement dies within 30 days. Plus the increased use of pain medications because joint replacements hurt. Shoulder surgery, you know, and once again, I'm not here to slam surgery. There are some situations you're gonna have to have surgery. When I tore my pec, when it's completely torn off, you have to have surgery. If you tear your ACL, you're gonna have to have surgery. But surgeries are overdone. Knee surgery, lots of pain. Average rehab time about 3 to 6 months. High percentage of complications on these things. 50% of people who have knee replacement have to go back for a second surgery. 50%. Average cost is about $57,000, and I know you might be saying, well, my insurance will cover it, I have really good insurance. What's your downtime worth? What's your time going to PT worth? And the bottom line is it's never going to be the same as what you had. Back surgery is the big one you want to avoid at all costs. They just did the study here in Ohio. The Ohio Bureau of Workers' Compensation wanted to compare people who had back surgery to people who avoided back surgery with the same exact diagnosis, people with disc injuries, okay? What they did, and then basically disc degeneration, disc herniation, or radiculopathy. What group did better? The people that had surgery, those who didn't have surgery? It wasn't even close. The people that had surgery, only 26% returned to work compared to 67% who avoided surgery. And those that had surgery had a 41% increase in the use of painkillers, in particular opioids. So I'm actually glad Ohio did just take a proactive step. In order to have surgery now, you have to go through a certain course of rehab. So you can't just jump to surgery. At least they're taking some proactive steps because they know that this should be the last step, not the first step. So this is where regenerative medicine comes in. It fills a nice gap in here because in the past, if you think about it, taking NSAIDs, cortisone injections, muscle relaxers, there's nothing in that that heals you. You're simply trying to mask the pain. So it's kind of like you run into the seminar tonight because you want to see me speak and your check engine light comes on, and you put a piece of tape over the light and keep on driving. It's a hassle, go to the mechanic, right? That's all pain medications do. That's all cortisone does. There's nothing healing in this stuff. And pretty much waiting off for surgery. Is anyone here told you're eventually going to have surgery? We're just trying to wait. Does that happen to anyone here? I hear it all the time. So they give you cortisone injections to get you there quicker. This is where regenerative medicine comes in because for some people, your body can heal itself. Is everyone here alive? Raise your hand if you're alive. If you're alive, you have the ability, you can heal, right? If you get cut, you heal?
Right.
Why can't your joints heal? That's what regenerative medicine is. And guess who's figured this out first? Who's been using regenerative medicine before the public? Who depends upon their body more than anybody? They make millions of dollars for it.
Athletes.
Correct, athletes. You know, and pretty much any athlete you can think of, whether you go Ray Lewis, Kobe Bryant, these guys have been doing this for years. And the reason they've been doing it is because it works, and they can't afford the downtime. So what is regenerative medicine? Well, it's not just stem cells, and we're going to talk about stem cells tonight, but there's other things too. Hormone replacement therapy. And we talked about that a little bit earlier. If you don't have testosterone or estrogen, you're not going to heal. Okay? Shockwave therapy, which is using sound waves. Has anyone here had a kidney stone? Did they use sound waves to bust it up?
No, they actually gave you Percocet.
I heard it hurts. I've never had it. But if they're real big, what they'll do now, if they're not going to pass, is they can use high pressure sound waves, not ultrasound, but sound waves to go in there and actually break up the stones. If you do the same thing on joints, it has the same effect. It breaks up the scar tissue and it opens up the vascular supply, thus promoting healing. Same exact instrument. Decompression therapy, laser therapy, ozone therapy, PRP, which is platelet-rich plasma, and stem cells. These are all tools in a toolbox to get your body to heal itself. So now I'm gonna kind of delve into stem cells. And what we're gonna focus on tonight are mesenchymal stem cells. There are different types of stem cells, but mesenchymal are what we use in orthopedics, and mesenchymal stands for tissue. Now, there's also hematopoietic stem cells, which is a blood stem cell. So if someone has a leukemia, you wouldn't want a mesenchymal, you'd want the hematopoietic. But for orthopedics, mesenchymal is what we want, and this is what we use. And they have some really unique properties. Property number one, when you put a stem cell into a joint of mesenchymal, it reduces inflammation. So if you reduce inflammation, what else do you reduce?
Pain.
Pain. Exactly. These cells also fight cell apoptosis, which is pre-programmed cell death. So what happens if you have an area that's injured and the cells are messed up, they commit suicide, they explode. And if you think about it, that's what degenerative joint disease is. Your cells are dying quicker than being reproduced. That's what degeneration is. So anything that can stop your cells from dying stops degeneration. And these mesenchymals do that. They can also differentiate into muscle, bone, fat, or cartilage. And they self-replicate. A mesenchymal stem cell lives for about 28 hours and replicates for 65 generations. So that's about 76 days is how long these things live and regenerate. You know, and this is the future of medicine. If you guys are on the computer like me, you can go to clinicaltrials.gov. It's a government website. And right now, worldwide, there's over 4,000 studies going on with stem cells. So this is the future of medicine. So how does this whole thing work? How does a stem cell work? We've all heard of it. We kind of explain what it does, but let me explain how healing occurs. So basically what happens if you have an injured joint, injured back, wherever it's at, that means you'll have inflammation and your cells are injured and they're dying. So when that happens, your cells send out a signal. And that signal is called a paracrine signal, signaling for help. And what happens then is your body sends its own stem cells to the area. We all have stem cells or we'd be dead, so your stem cells go to the area and they attach to the local vasculature. When they attach to the vasculature, they change from a mesenchymal stem cell into this thing called a periocyte. And the periocyte releases growth factors, feeding your dying cells and bringing them back to life. That's how healing occurs. So you have an injury, that injured cell sends out paracrine signal, attracts your own stem cells to the area. Your stem cell comes, attached to local vascular supply, becomes a periocyte, releases growth factors to feed your dying cells and bring them back to life. That's healing in a nutshell. And as I said, we're all undergoing stem cell therapy as we sit here tonight. If we didn't have stem cells, we'd be dead in a couple days. And they actually, there's a lady that just died in Germany. She was 115 years old and she donated her body to science. And the cool thing about her is she didn't die from cancer or heart disease, she just died. So when they did the autopsy on this lady, her cause of death was she had no stem cells. It's crazy, right? So you have to have it. This is the problem though. As we get older, we have less. So if you look at a newborn baby, 1 in every 10,000 cells in that baby is a stem cell. That's why if you go to Columbus, a children's hospital, and I don't think they're doing it here yet, but the baby has to have open heart surgery, they do it before the baby comes out of the womb. And when those babies come out, there's little to no scarring. Why is that? All the stem cells in the baby and the amniotic fluid. You get a little bit older, I have a teenage boy, he's 13 years old, he's about 1 in every 100,000 cells, and as you go down the line, you can see less and less stem cells. My 13-year-old boy, he races go-karts competitively. We were at a race event about a month ago. He had a real big crash. His wrist was all swollen up afterwards. He's like, Dad, I'm not gonna be able to race tomorrow. I'm like, that's fine, we'll hang out and watch. You know, we iced it, whatever. We got up the next morning thinking we're just gonna go watch the race. He's like, Dad, I'm ready to go. I'm like, well, what about your wrist? The thing was on fire. He goes, what, it's fine. Why is that? All the stem cells. Now, if it had been me, I probably wouldn't have made it. So, as you can see, as you go down the line, less stem cells. We also have another problem. Remember we talked about the stem cells. The stem cells have growth factors and it feeds your cells. As you get older, do you think you have more or less growth factors? Your stem cells are healthier or weaker? They're weaker. So as we get older, our stem cells, not only do we have less volume of them, but they're depleted of growth factors. So less stem cells, less growth factors, less ability to heal as you get older. So that's why the knee injury, wrist injury, back injury that when you had a kid you recover from in no time, doesn't work out so well as you get older. And it's all about those growth factors. Remember we talked about that. There's epidermal growth factors, fibroblastic, hepatocytes. These things are setting up vascular supply, scaffolding, everything, and actually healing these joints. So you can see here, you have your injured cell. It would send out a paraffin signal. And at this point here, they've attached the vasculature and become parocytes, and they're feeding that dying cell, bringing it back to life. That's healing. Now I'm going to go over the different types of regenerative cell therapies that are available. And I want to start off with the first one, because the first one is why I think stem cell therapy has a black eye in many people's minds. And the first type of stem cell therapy that was available was embryonic stem cells. These are from aborted babies. This is illegal in the United States, always has been. So this is why in the past, when people wanted stem cells, they would fly to Europe, because it's been legal in Europe since the beginning. I can remember Kobe Bryant in particular would go to Europe to get stem cell procedures. Why? They had embryonic stem cells. But what we found with time and technology is you don't need to use aborted babies to get stem cells. You can get those from other sources. The next thing we'll talk about is PRP, which is platelet-rich plasma. Has anyone heard of platelet-rich plasma? If you watch sports, you hear about it all the time. All the athletes do platelet-rich plasma. We do this in Troy. We just did one procedure tonight. This is going to be categorized as an autograft. And what autografts are, I mean, they are from yourself. You're donating to yourself. And with PRP, basically what we do is we draw blood out of you when you come to the office, and we can spin down and get your own growth factors out of your blood. And we inject it back into an area of injury, feeding your stem cells and making things heal much quicker.
Called blood doping.
Blood doping would be for red blood cells. So different. So that would be trying to harvest red blood cells and put them back in. This is to harvest growth factors. So, because basically what we're trying to do is you have an area that's injured, want to speed up the healing process, put growth factors on top of your own stem cells. Now I did mention lots of athletes do this. What's the average age of a professional athlete? Yeah, I mean, 30 maybe if they're, depending upon, but the more active the sport, usually the younger. And the reason I say that, those younger people have more stem cells. So they don't need stem cells, they just need their stem cells to be more efficient. That's why PRP works very good for younger people. As you get older and have less stem cells, this becomes less and less viable. This is where we go to the two ways you can get stem cells from yourself. At the beginning, you asked what that person was doing, by the way. I forgot to answer that. Sorry. She was doing a bone marrow on a cadaver. Okay, we practice on dead people before we do
So
live
that
people.
was a chest without the
It was
knee.
this. It was a torso.
Oh, the torso.
It was a torso. Sorry, I don't have to say that earlier. But basically, bone marrow. And bone marrow is just what we say. We have to harvest bone marrow. We can either harvest it from the iliac crest here, or we can do it from the tibial plateau here. A couple problems with bone marrow. Number one, do you think it feels good? No. You can numb the skin, you can't numb the bone. Okay? Second problem. Remember we talked about different types of stem cells. Bone marrow is loaded with hematopoietic stem cells, blood stem cells. So if you have a leukemia or a blood cancer, bone marrow is what you want. But there's not as many of the mesenchymal cells there, which is what we want for joint reconstruction and injury healing. So it's not the best source. That's where adipose comes in, which is body fat. So I know what you're thinking. I get a liposuction and sign of a Dr. Bryson in the back. No. Okay. Adipose is loaded with mesenchymal stem cells. Loaded. The problem with that though. Adipose, number one, if anyone's ever seen liposuction procedures, fairly aggressive. So we have to numb you up really good. So basically you put an infusion of lidocaine and saline and blow that area up before we go in there and harvest out. Lidocaine kills stem cells. So although there's a lot of cells there, how many survive the harvest is at question. And the other thing you have to consider, anytime you're doing any type of autograft procedure, what is the host health? The older the person gets, the less healthy those cells are. Okay? That's where we come into allografts. And allografts are donors. Okay? And the first type of allograft I'll talk about is placental allografts. Placental allografts are for people that have elective C-sections and they donate the placenta. Okay? Those placentas are loaded with growth factors. There's no live cells, tons of growth factors. And those growth factors are day zero growth factors. Very strong. But no live cells. But the latest and greatest is cord tissue. Cord tissue is from people that have live healthy births and they donate the umbilical cord. They throw it away anyways. The umbilical cord is loaded with day zero mesenchymal stem cells. okay? Even a half cc of this product has 500,000 live cells. And I just got back, me and Dr. Bannon just flew out to Utah to see how the procedure is pretty amazing. But these come in, you know, they basically, it's all very time sensitive, and they harvest it and they get that, and it's all regulated. So pretty cool stuff. We talked about the regulation. One thing we did notice, the people that get either the placenta or the cord tissue, they're regulated by the American Association of Tissue Banks. So the same people that are doing organ donation are the people that are harvesting the placenta and cord tissue. And these also are stringently tested by the FDA. So the same testing that goes for blood and for organs is done to these tissues. You know, so people ask, is it safe? At this point here, it's not even debatable. There's been over 500,000 procedures done with placental and cord tissue in the United States and Europe, and there's never been a side effect. So you can't even debate the safety at this point. So I'm going to show you some examples of some people we've done. You can see here, pre-X-ray, bone on bone, or you know, they were told bone on bone. There's obviously something that the joint was still moving, just after 6 months. We're not doing anything, we're getting the body to heal itself. This next one here is an MRI of a shoulder, which you wouldn't, if I had a picture, it wouldn't make sense, but I'll show you what the radiograph was. This person here had a tear in the rotator cuff of 2.5 centimeters. That's big enough to do surgery, which is, if you know centimeters, millimeters, 25 millimeters, okay? Supposed to have surgery. 3.5 months later, that same tear, 25 millimeters down to 3 millimeters. The muscle healed. No surgery. This person here was scheduled for bilateral knee replacement, was petrified of surgery just after 5 months. I have a couple testimonials I'll play real quick. My speaker operates.
Hi, my name is Sandy, and I have osteoarthritis, or diagnosed with osteoarthritis in my knees, and I've been bothered with it for 10 to 15 years, and I had arthroscopic surgery on my left knee, and I've had multiple cortisone shots. They last for a little while, but nothing has been permanent. The pain, when it felt worst, it was like constant nagging pain to the point to where I really had to do a little bit, sit down, do a little bit, sit down. So I had seen a video and went to a consultation here with Buckeye, and was told that I was a good candidate and this would help. So I did it, and I have not regretted any portion of it. It has been a smooth transition. There is no invasion, and that part I really liked, because the recoup has been very smooth. And as long as you do as you're supposed to do, you should feel much relief. Even after the 3rd day, I felt that the pain had totally stopped. And sometimes I feel a little tightness, but it's just very minimal, and it's been a good process, to the point that I have increased my walking steps and been able to go without pain. And for that, I say thank God.
Hi, my name's Chris. I've been a long-time patient here at Buckeye PMR. I had a condition that was a tear in my shoulder, and also a tear with some other injuries going on, and a tendon in my hand that left me without a grip. It was an all-duty injury, and I couldn't grip anything. It was even so much pain just to be able to hold a coffee cup and bring it up to my mouth. After seeing multiple doctors and listening to everything they wanted me to do, and going through a couple of months of therapies and stuff like that, it just wasn't getting any better. And so one of the surgeons recommended that they go in and repair this tendon and move it down on the bone a little bit to relax it. But it was going to be a 10-month recovery for that. And my lifestyle just won't allow for anything like that. So after talking to the doctors here at Buckeye PMR, they offered some terrific solutions that they thought might benefit me. I was very skeptical about some of them at first because I've never heard about anything of them. But I ended up having the platelet-rich plasma treatment done. And it was absolutely incredible. Within 3 days, I had probably 75% of my strength back in my arm and in my shoulder. Like right now, I was off work originally for like 3 months with the injury, and like I said, after it was done, it came right back. Within 3 or 4 days, I had 75% of my movement and everything back in my arm. I strongly encourage you to sit down with these docs. They have plenty of tools in their toolbox to help any injury that you might have. That's it.
One thing I do want you to know is they didn't do these at the same time. It was the same room. But they both said they were better in 3 days. Her knees didn't regrow in 3 days, and his tendon wasn't completely healed in 3 days. But remember, we talked about when you're putting growth factors or stem cells into an area, they stop inflammation, which stops
Pain.
Yeah. You know, this year we've done almost 300 regenerative procedures and stem cell procedures at Buckeye, and our success rate is over 90%. So I know you might be saying, well, I'm not doing it if it's not 100. I'm not a sure thing, right? Why is it not 100? The people that haven't done well feel better and go back to doing stuff they shouldn't be doing too soon. When you get stem cell procedures or PRP procedures done, for 2 weeks you have to pretend you had surgery, which is hard because you a lot of times will feel a lot better quickly. But you have to pretend you had surgery because that first 2 weeks is crucial. That's when the scaffolding's laying down. That's when the healing, the foundation of your healing occurs. I have a pit bull. I just did PRP on my pit bull. Crazy story, right? He hurt his shoulder. It wasn't getting better. Went to the doctor. They want to do cortisone. Hey doc, I don't want to do cortisone. It causes all this damage. Okay, yeah, I agree with you. What about PRP? He's like, well, I haven't done it. And I said, well, I'll bring my unit. If you inject him, I don't know how to inject a pit bull. And we did it. 2 days later, he was feeling better, and I had to keep him in the cage for 2 weeks. He was hating me for 2 weeks, and I couldn't even explain to him what was going on. But he's back. I don't want to cage you guys, though. These are very simple procedures we do in the office. Typically, you'll feel better in 24 to 48 hours, but trust me, if you're bone on bone, it's not healed in that amount of time, okay? Usually we say with stem cell procedures, for the worst bone on bone, it's 6 months. So the healing goes on for 6 months, okay? Couple requirements though. Remember when we talked about cortisone and how toxic it is? If you've had cortisone in a joint, we can't touch it for 6 weeks. Because for the next 6 weeks with the cortisone there, everything's dead, okay? We also ask that post-procedure that you don't take any NSAIDs, which are non-steroidal anti-inflammatory drugs. Aleve, Advil, any of these anti-inflammatories. Why is that? Those also kill stem cells. So if you're sitting here tonight and you're taking Advil or Aleve every single day, you're killing your own stem cells.
Tylenol too.
Yeah, even Tylenol. At this point here, these procedures are considered elective, so it's not covered by insurance. Typically, if you need x-rays, MRIs, any type of rehab post or bracing, that is covered. And cost really varies upon condition. It could be anywhere from $600 to $5,500. Really depends on what you got going on. Not everyone here would even need stem cells, okay? But we do have financing in the office if you qualify. So the bottom line, if you're sitting here tonight and you have had pain somewhere for longer than 3 months, you have to make a choice. Do something about it, try to regenerate the joint, or just wait for surgery, okay? And not everyone here would qualify. I'd be lying to you if I said I can help every single person here. We probably can't. But I don't know if I can help you or not if you don't come to the office. So what we're offering at the end of the seminar here tonight is if you want to come to the office for a free consultation to see if you would qualify, it costs you nothing. You just need to show up with your driver's license. That's all. I have to know who you are. Come to the office, we'll sit down with you, we'll spend a half hour to 45 minutes with you, explain your problem, do a complete workup, and I'll tell you if we can help you or not. So you really have nothing to lose. So please, I know the way we usually do this is we're really busy. If you're interested, sign up in the back tonight, because if you call in to get an appointment, I think we're booking out to next month if we don't take walk-ins. So you have no reason not to take advantage of it. Does anyone here have any questions about anything? Yes?
If you've had a lot of arthritis scoped out of your knee,
Mhm.
does that make you possibly not a candidate?
Could you have range of motion in your name?
Do I have range of motion?
Yeah, I mean, you walked in here, I don't see,
Yes.
I mean, that would not preclude you from having that. We'd have to do an exam on you, obviously, but, the majority of people come in with knee problems, have had meniscus and all these different types of surgeries. That's why the knee is worn out. So I would say what you've experienced is pretty typical for the people we treat. I do want to raise one thing too. When you come in, if you have any x-rays, MRIs, or diagnostic tests that you've had in the past 6 months, bring those with you. If it's past 6 months, they'll be useless because it's probably degenerated past where that's at. But anything you have that's fresh, 6 months or newer, please bring with you. The more information we have, the better. Okay, I'm sorry. Yep.
Do any autoimmune conditions fall under opening with this?
Like
Autoimmune arthritis?
Like RA?
Yeah, or reactive arthritis, but yeah.
Mm-hmm. Yeah, we have quite a few people that have had rheumatoid that we've done real well with. And a lot of times those people do really good with ozone, to be honest with you.
What's ozone?
Ozone, just like from the atmosphere, O3.
Oh,
So,
oxygen?
yeah, well, not oxygen. So oxygen is O2, ozone's O3. There's a huge difference. So O2, oxygen's a very stable molecule. So if I just inject oxygen into your joint, nothing happens. Ozone, O3, is very unstable. That third the oxygen molecule wants to jump off. So when we put it into your joint, that oxygen molecule jumps off and oxidizes the joint. And that oxygen causes healing. Get your own stem cells to release their growth factors and upregulates growth factor receptor sites. So if you really think about it, the areas you don't have that don't heal are areas that have poor oxygen supply. Knees, backs, usually muscle bellies heal. Areas with oxygen heal. The lack of oxygen is what stops the healing. So sometimes, in particular, with younger people where it's not that bad, you put ozone in there, you get your body to heal itself. Pretty simple procedure.
Excuse me.
Yeah.
Do you have any cards?
Travis will have some in the back.
Yeah, okay.
How do you go about inserting the injections like in a hip area or something like that? I mean, as far as how do you know you're getting in the joint itself? You don't do it under X-ray, do you? I mean, how do you?
Ultrasound guidance.
Ultrasound guidance.
Yeah,
Okay.
the ones we don't do in office would be spinal procedures.
Okay.
Spinal procedures we do under a C-arm, so we send that out to a facility.
Okay.
Just because the ultrasound wouldn't be strong enough. But any hip, knee, shoulder, those are pretty simple injections.
And how do you know? I mean, without going to a doctor yourself and having something diagnosed per se. I mean, what if somebody just comes in and says, I got pain in my hip. I've had pain in my hip for a long time. I mean, how do you guys go about?
Take an X-ray.
Oh, okay.
And William give you, when you come in, we'll take X-rays for free when you come in.
Oh.
Usually like to have it, and people sometimes come with X-rays. We like to see you standing or loaded. So a lot of times they'll take knee and hip X-rays with you laying down. That's kind of useless because I want to see what it looks like when it's actually loaded.
Okay.
So if you don't have anything like that when you come in, probably one of the first things we'll do is take an X-ray and see what's going on in the joint. And a lot of people come in and have been told they're bone on bone, and we take the X-rays and they're not. So I want to see it with my own eyes.
So what does insurance cover?
If you needed any rehab post, if you needed any bracing post, other workup stuff potentially. Yeah. And we do procedures that are covered by insurance, like we do Synvisc and other stuff. We won't do cortisone because even though we get paid for it, it's, in my mind, doesn't make sense. We just don't do it. But like Synvisc, there's nothing wrong with that. It doesn't fix anything, but at least it's not counterproductive, right?
So does it help like bulging disc or herniated disc, anything like that? In those areas?
Yep.
Are those things you
Backs are more complicated because is it the bulging disc? Do you have a facet issue? Is there some type of encroachment? So usually with that, I want to do a workup on you and see what's going on. And a lot of times with back, it's more of a factor. You have a disc with a facet with other stuff. So
What if it's more than one area of your body? If it's a hip and a knee, you find out. Do you guys do multiple procedures at one visit, or is it a separate?
you can do multiple procedures on the same visit, but they don't migrate. So if you had a knee problem, we put stem cells in your knee, they wouldn't migrate up to your hip. So we'd have to put it in the capsule and in the capsule. Yes.
Is this a one-time thing, or is this something you have?
We've never redone a stem cell.
Okay.
So you shouldn't have to. Now, obviously you could get injured and you might need it again, but we personally have not done it. This is a one and done. Okay.
Is there any danger in if you get those stem cells, they're not your own?
No.
No.
No, there's no HLA. This is not a blood product. It's a tissue allograft. So there's no matching whatsoever. Now, if it's a blood product, then you have matching issues and everything. But these are HLA privileged.
Where are you located?
In Troy, we're right up the road. What's that
Across
south?
from Tractor Supply Company, across the street.
Close to your profession.
Yes.
Could HB
No, we did a lady that was 94. Now, we talked about, she would be a terrible candidate for her own tissue. But if you're using an allograft, a donor tissue, it doesn't matter. Because they're all day zero. So, you know, so younger people can use their own tissue, that's fine, we do both. But as someone, really like that 35 to 40, that's when I really push people hard to use the donated tissue. It's just better. And we've done both. This year to date, we've done almost 300 procedures, so no one in the state of the country's done more procedures than us. So I've seen both. There are some people that come from religious regions that can't use donated tissue, so we will do that, but the results, you can't compare adipose to cord tissue, results-wise.
Did you just ask the question about how long it will last?
Yeah. So the question was, how long do these stem cells last? And they should last the rest of your life. So we don't this is not something you plan on coming back every year and redoing. And to date, we haven't redone a stem cell on anybody. Now, does that mean it would last forever? I mean, you can get re-injured if you have some improper biomechanics to wear it back out. And we can't promise you, but to date, we haven't redone any. And that's not the plan. I'm sorry?
Since you probably don't have enough data behind you.
We've only been doing it for a few years. But you're regrowing tissue, so I mean, what you have to look at mechanically, if you did something mechanically to wear it out in the first place, you'd want to address that. Which we look at you when you come in. Sometimes we brace you, or, you know, it depends upon the individual.
Can you tell us what conditions preclude you from not being able to have the procedure? You said, or factors involved, you said not everybody's a candidate.
You got to look at the level of degeneration and the functionality of the joint. So we do an orthopedic exam on you. So if someone's knee is locked, shoulder is locked, it's not going to unlock.
But if it's functioning and they bend and they walk and that's
Usually, I don't promise anyone, I gotta see it, you know, but if someone has a torn pec, it's not gonna reattach a pec. If you have a torn ACL, it's not gonna fix that. You have to have surgery.
Yeah.
But if it's degeneration, bone on bone, but the joint still moves, there's a good chance.
So
Yes.
you said, I'm sorry.
Oh, good, sorry, I'll get to everybody. Go ahead, I'm sorry.
Okay, two questions.
Mhm.
Is the cost different if you use your own cells versus donor tissue?
It's the same.
Okay. And then a person who's had a replacement of some sort, is this option, or you just have to continue having surgery?
If you've had a joint replacement, you wouldn't put stem cells there because you can't regrow on top of, you know, on top of that. If you have, but there are quite a few people that come to us that have had joint replacements that hurt or are angry. That's another thing where ozone works really well, because the ozone will shut off that neurogenic pain. A lot of times what happens when you have a joint replacement, you damage the nerves and they become hypersensitive. So they're just firing for no reason whatsoever. Ozone will actually shut that off.
Just, I can throw a third one in here, a person who, like, you're just speaking about nerve endings or nerve damage or something, people deal with fibromyalgia or anything like that, is the ozone something that can help that?
Yeah, 100%. We just had a police officer we treated yesterday. He was shot in the butt, but the bullet hit his lumbar plexus, and it felt like his foot was on fire. He actually wanted to get his foot amputated due to pain. We did one ozone injection, and he was about 80% better. Yeah, I didn't expect that result, but it just shuts that neurogenic pain off. Yeah.
So you said earlier that you have to like give yourself like 2 weeks recovery time? Is that correct?
Yeah. So if you did a knee or a back, you're not bedridden.
Okay.
But because your knee is feeling good, don't decide to go to Disney or go hiking somewhere. You know what I'm saying? So pretend you've had surgery. So
So if
whatever.
you've got a job where it's physical demands on you, you
You
wanna
want to lay
take
low.
off or take
Yeah,
these?
yeah, for sure.
Okay.
Yeah, like you were saying, like a back for 2 weeks afterwards. We've done quite a few massage therapists, like, as an example. I say for 2 weeks you need to lay off the massage just because you want to let that thing kind of just settle down. And then after 2 weeks, if it doesn't hurt, you do it. If it hurts, you don't do it. You just listen to your body, because you're not going to be on any NSAIDs or any pain medications. So your body will tell you what you should and shouldn't be doing.
So is this an injection kind of therapy, or is it any kind of, it's not surgery at all?
No surgery whatsoever. So stem cells or PRP or ozone, with the thing that kind of talking about a little bit thing, those are all injections. And if you've had a cortisone injection hurts worse.
And
Very
is this-
small gauge needle.
And is this something that takes once you're in the office, it takes what, half an hour, 10 minutes? What, is it pretty simple? Like,
Probably 5 minutes.
okay.
Yeah. I mean, it's pretty simple. You know, basically you come to the office. The cells themselves are on liquid nitrogen, so they're minus 200 degrees. So it's usually when you come in, we'll take them out. They got to defrost, so we have to wait for that process to happen. once they defrost. Typically with stem cells, what we've been doing is doing the ozone first and then put the stem cells right in there. The reason we use the ozone is, once again, we talk about getting oxygen in that joint. When you put that oxygen there with the stem cells, it helps them release the growth
So
factors.
you do them both at the same time?
And then we've had really good results with that. Obviously, things are changed over time, and that seems like that technique's working best for us right now. Yes.
Use tonight.
Yeah. Yes.
As it relates to the fibromyalgia, is that something that you have to do over, or is it the same premise because it's the ozone versus the stem cells?
There's no cookie cutter on that, unfortunately. Yeah, I can't give you an answer. It would be one treatment or
Okay,
5
but
treatments.
it's not the same as the injection?
Stem cells are one. You only do one stem cell. Ozone typically we do in series.
Okay, and then when a person comes into your office, I know you said you like to have chiropractors and massage therapists kind of in the office. When you do the x-ray, do you see like, hey, this isn't, you're really not a candidate for this, however, the chiropractic issue, you need to continue?
Potentially, yeah. So the way things work in our office is you'd be seen by probably a chiropractor and a medical provider, and then we have a team meeting. So they sit down because chiropractors and medical providers' brains work a little bit differently, and they both add something to it. So a lot of times they'll look down and say, this is just a medical problem, this is just a chiropractic problem. Hey, we can work together on this thing here. It's case by case. So, but to answer your question, but they sit down together on every single patient that comes into the office and have a team approach. Yes.
What would you say the average cost of a knee is currently?
Is the worst of the worst?
The average, yeah, all
Well, our average is the patients we get, someone told you have to have knee replacement and you're petrified of surgery. That's who we see. So we don't get phase 1 or phase 2. I would say, we use Dr. Bryson, 90%
It's the
of
worst,
it.
yeah.
It's the
Like,
worst of the
almost
worst.
everyone that comes in, like for knee, it's always bone on bone. So we hear all day long, bone on bone.
Yeah, so that's typically what we're dealing with. People don't come to us as a port of entry. Usually they've been through all the cortisone and all the garbage first, and they really messed it up good. So a bone-on-bone knee that would need, you would probably need, with those we do stem cells, we usually use some amniotic fluid and do ozone and do shockwave. So these are all tools in the toolbox. That'd be about $4,500. And that's for all the procedures. But that's the worst of the worst. Now, other people come in and told me they're bone on bone and their knee looks fine. And we just do a couple ozones. So I really want to see it myself first.
So do you guys determine what course of action is best, like, so you can't just come in and say, I think I want stem cell done, you guys come in?
You might not need it, yeah.
You guys look at it?
Yeah, we look at it together, and you look at it too. I mean, but if you're bone on bone, you probably need stem cells. If you're not bone on bone and just have pain, then maybe some PRP or some ozone work, or maybe just shockwave too. A lot of times it's just tendinopathy, and shockwave works great. So it really depends on the individual what you got. But stem cells are for the worst of the worst. Bone on bone, you're gonna have surgery. That's what stem cells are for. Yes.
If my legs about 2 weeks ago started popping and everything is
Now
that
your knee or your leg?
from the knee halfway down?
Yes, it's probably your knee then.
Does that mean it's bone on bone or?
That means you got some type of tendon or functionality issue. It could be, but it could be just some severe tendinopathy too. We take an x-ray to see. What that is, that's crepitus. That means the joint's not functioning properly, but that speeds the process up though. If it's doing that, it's not good. Yes?
So do you make, you said we come in for a free consultation or whatever, and you tell us all that information that day, or do you get back to us? How does that work?
Depends on usually like knees and hips are pretty easy. We just shoot an x-ray and do an orthopedic examination on you and get a history. Sometimes with backs and shoulders, we'll want an MRI to make sure we're doing the right course of action, just because those are more complicated joints and we just need to see different stuff.
But like if we went in there, I just have knee issues and had that done, so you'll probably have it, like you tell us, hey, this is what we think you need to do that day.
100%. Like knees, hips, those are the easiest. Backs and shoulders are the most complicated.
So, my mother has bone on bone, and she has some like little chips and floating around things that pop and whatever in there. Is that a possibility that you couldn't work on?
Is her knee locking up at all?
Locking up?
Yeah.
Not really, no.
Okay. Yeah, if it's not locking up, there's a good chance. If you have a joint that's locking because of particles, you usually have to get those particles taken out. But if her knee's not locking
It's
yet,
just more the grinding, but.
that's crepitus. She might be fine. But if her knee's locked, like she walks and literally gets stuck, you typically have to have surgery to remove those fragments. So if she's not there yet, then she's probably, there's a chance she's a candidate.
What about, is this affiliated with people that came from California originally and did work here with stem cell therapy in Ohio?
No, I mean, my training was through the American Academy of Anti-Aging, which is the University of South Florida. But they're the only organization at this point doing fellowship training, and they're worldwide. So when I go to my seminars, there's people from all over the place.
So you don't have doctors that fly in from California to do this?
No, we're located in Ohio.
Where's your office at?
We have an office right here in Troy where we're doing procedures
Is this
at.
the Buckeye place that you were talking
Yep.
about?
Well, it's Troy Physical Medicine and Rehab. Yeah, they're an affiliate of Buckeye.
And that's where you are? Are you one of the people that do the procedures?
Yeah.
You didn't introduce yourself.
Oh, I'm sorry, yeah, I'm Dr. Buscourt. And Dr. Patrick Bryson's back there, he's physician there. And Sophia Bainan is the person who she's the one who's been doing the procedures here in Troy. And she's also fellowship trained.
Okay, so she brought this to you guys? Or?
No, we're at the same time. We're partners. We're tag
Is
team.
this catching on all over? Because I've never heard of it anywhere else but here.
We're the largest in Ohio. I would say things go from West Coast to East Coast, so it's much more prevalent on the West Coast. It seems like it's catching on in Florida. Things kind of move slow up here. I don't know why.
It's affiliated with, everybody's running to Missouri, to Chesterfield, Missouri.
I don't know who's there.
Yeah, we get a lot of people that check that clinic out.
Is
Yeah.
there one in St. Louis also?
Yeah, there's a big one in St. Louis that does it. It's a little bit different than our procedures.
Is that a Regenix?
Yeah, and they
Okay.
basically, I can tell you, first of all, they claim stem cell, but they're doing PRP. So they're doing the growth factor, they're not doing.
Yeah, so remember we talked about,
It's different. Yeah, because we always get, price comparisons, and it's not apples to apples, it's apples to oranges.
no, PRP, which is platelet-rich plasma, and we do that. We just did one before I came here tonight. We had an individual that came in, his hip wasn't that bad, and he was 40 years old and of good health. That's why I didn't think he needed stem cells. We did PRP on him. Basically what we did is we drew blood out of him, and we spun it down, and we captured his growth factors, and we put it back into his hip. So there's no stem cells in that, but there's lots of growth factors. And in his situation, he wasn't really bone on bone. He just had a chronic tendinopathy, and it was a little bit thin. He didn't need stem cells, so we just did PRP. So that's platelet-rich plasma. Now you'll hear platelet-rich plasma in the media a lot, because that's what a lot of the athletes are using because they're younger. And the younger you are, PRP, like the person who did the testimony there, he's a younger guy. He didn't need stem cells. PRP is great. If you're bone on bone in your knee, PRP would not be a good option. You would need stem cells just because you probably don't have a lot of them.
I don't feel like bone on bone because actually August the 4th, I had a meniscus tear. That's what started this whole dumb thing. And then we got in there, they said it was a stage 4 with arthritis, and they scoped that all out. That's when all my pain started. But now it's kind of.
We'll take an X-ray and we'll see what's there.
It's leveling off now, so.
You might not be bone on bone then. Maybe you just got some chronic inflammation and ozone or shockwave would help. But if it's bone on bone, stem cells. But we need an X-ray with you standing to tell.
So the oxygenation you're talking about, PRP stuff you're talking about, are those kind of one and done things too, or can they be a multi?
PRP is usually done one and done. It's a couple times we've done it more than one time on people. Ozone is usually done in a series of 6.
Okay.
So once a week or every other week for 6 weeks. Because basically all you're doing with those is you're getting your own stem cells. You're basically feeding your own stem cells.
Okay.
So those we usually do in series.
And the shockwave, is that kind of?
Usually 3.
Okay.
And they're all good for different things. So if you have plantar fasciitis, patellar tendonitis, lateral epicondylitis, which is elevated, shockwave's amazing. But so it really depends on what the condition is. But I suffer with plantar fasciitis forever. Shockwave's the best. It doesn't hurt because usually shockwave's cortisone in the heel, which kills. Shockwave is way better and it
You
works.
know, it's just not old age. Like when I come to you how do I know? It's just not old age. It's just
Well-
my job and the old age.
Well,
Or age.
your ability to heal as you get older because you have less stem cells and you become hormonally challenged is a factor.
Yes,
You can handle your hormones
yes.
and you can handle the other stuff. But as you get older, yeah, we just break down faster because of hormonal insufficiencies and less stem cells.
And you guys can help with all this stuff.
100%. You know, and a lot of females in particular don't do hormones because they're petrified they're going to cause cancer and all this stuff. Because most of the female stuff out there aren't even hormones, they're drugs that mimic hormones, which is sad. So you go to your doctor, hey, I'm having hot flashes or I have osteoporosis, okay, we'll give you estrogen, and they give you Premarin. Well, Premarin's not estrogen, Premarin's a drug that mimics estrogen.
Right.
And Premarin causes cancer and all this bad stuff.
My
If you're on a bioidentical? Okay. And you wanna make sure that bioidentical, you wanna have a ratio, because there's 3 estrogens, E1, E2, and E3. You don't want any estrone, which is E1. You want estradiol and estriol. And usually you want it 80-20, you want 20% E2, 80% E3. That's the best and the most anti-cancer.
Cause I go to a, Dr. Peterson's my gyno, she's like, she's the one that got me turned on to all that stuff, she's a.
If it's bioidentical, it's fine. But you just have to make sure that most of the prescription stuff from Big Pharma is not bioidentical. So she's probably getting it from a compounding pharmacy. Yeah. Big pharmaceutical companies won't make bioidentical because you can't patent it, there's no money. So if it's from like a Lilly or something like that, it's not bioidentical. But if it's from like a compounding pharmacy, then it's probably bioidentical. And there'll be no, now you can tell, bioidenticals, there'll be no side effects. There's no label to read, because there is none. If it's a drug, there'll be tons of side effects. And when you open it up, there'll be tons of stuff that says it can possibly happen. Bioidentical, there won't be anything in the label. That's how you tell the difference.
I'll bring it in.
Yeah.
Look at it.
Because a lot of people think they're on bioidenticals and they're not. And maybe you are, but if there's a label,
Well, there's a thing that comes with it.
Well, you said
It's in a
Lily.
box.
a big pharmaceutical company will never make a bioidentical because you can't patent it, there's no money. They'll never make it. So what drug companies do is they'll say, hey, we know estrogen's good to help prevent osteoporosis and prevent hot flashes. We can't make any money, so let's add a molecule to it. We'll say it's estrogen, but it's really a drug that mimics estrogen and we'll make millions of dollars. That's how it works. It stinks.
I'll bring it in.
Okay, please do.
Got one here.
Yes, sorry. Yes.
The MRI and X-ray, is that all included in that?
X-rays, yes. MRI, no. But you might not even need an MRI. What do you have bothered?
Well, I was thinking about him, I've had an MRI on me, and kind of go doctor, brain scans.
Knees, usually we just need X-rays.
What about shoulder MRIs, what they cost?
You have insurance?
Yeah.
Usually insurance will cover your MRI, so it would depend upon what you got going on. So you have a shoulder injury, but you never had a shoulder MRI?
Oh, yeah, I've got 2 shoulders.
He's not had downtime to do it, so. This might be easy.
Yeah, shoulder surgery and rehab time is brutal.
When you get stuff, have a surgery.
There would be no rehab done.
No, but you wait, I mean, and you might need surgery, I'm not saying you don't need surgery, but when you wake up from surgery, the longest recovery is on surgery, shoulder surgeries.
Really.
Longer than knee, longer than hip, longer than anything.
I had knee surgery, I went back to work the next day.
Yeah, knees can be easy.
Yeah.
Shoulder's a tough one.
Another question, this presentation, do you have it on YouTube or anywhere that we?
I'm recording this tonight, so I'll have a link on YouTube that, if you guys come in, I'll give it to Dr. Bryson and you can have it.
And you can always have to come over to the office and we can work. You can watch this here, we can sit around and answer questions.
Oh, yeah.
We do that as well, so.
I grew up there.
But usually with shoulder, come in, we'll look at your shoulder, but because it's complicated, you might want to have, because if you have a total rupture or something, you'll have to have surgery. It is what it is.
I use it all the time, I mean,
We used to get insurance for that, what's the,
Yeah, yeah. We take insurance, yeah.
do you do surgery?
We do not do surgery. We refer out for surgery all the time, some people need surgery. I'm not anti-surgery in the medicine. Sometimes you need it, you know. But I just think that they're overdone. That's all. So when you come in, we'll look at it, and if I think you need an MRI or something else, we'll get it and see what's really going on.
Right there.
And maybe you won't, I don't know.
When I was growing fistula,
Yeah, of course.
And this kind of goes back to that slide you said, we were arguing who, and even.
All right, wait, what's the question, and tell me who convicted?
No insurance for 30 days.
That's what I said. And you think
NSAIDs kill stem cells, so if you're taking those now, you're killing your own ability to heal. No, after. Yeah, so no cortisone 6 weeks prior, no NSAIDs for at least 30 days post. He wins. Yeah, he wins. Yeah, but the cortisone 6 weeks prior is a no-go.
Can we keep taking opiates? Can we keep?
Well, the problem is most, the opioids themselves don't kill stem cells, because most of the opioids have NSAIDs mixed with them, you know? Yeah.
And the last question for me, did you say when you come to your office for the consultation, that you do
Thanks.
X-ray at the consultation?
No, thank you. Yeah, so what you'll get when you come to the office for free is a consultation, and if you need any x-rays,
Okay.
we'll do those complimentary. But you do have to, what we do ask you to do is bring your driver's license with you, so just for HIPAA, it's a rule we have. And if there's anyone else that helps you make a decision on what you do, bring them with you too, because usually people have tons of questions. What's happened quite a few times is you'll come, and you'll wanna do it, but you'll go home and tell your husband or significant other, and they'll say, you gotta explain this to me, and we have to do it twice, and we're just really busy, so.
Right.
You understand?
Okay, cool.
That's all.
Thank you for your time.
Oh, no, thank you.
How long after like post-surgery? So, I reckon like if somebody's still in pain post-surgery, is there a certain amount of time you want them to wait so they can see you?
Really, you should have either PRP with surgery or immediately following. Now, a lot of progressive surgeons are doing PRP right after surgery, which is great. I mean, that's why the pro athletes are getting back so quick, they're doing PRP and stem cell surgery. That would be ideal.
With me, I mean, being 48 and having a PRP done.
I mean, it's
Don't know what that would be.
What's the injury?
They did the meniscus and they cleaned up the arthritis.
I think ozone might be better.
It, and I haven't.
Oh, they did PRP?
No.
Oh.
And ACL from 20 years ago.
Well, they didn't do anything.
But no, he just did clean up, trim the meniscus, took out some fluid.
PRP wouldn't have been bad for you, but just less effective because you're old. But you seem fairly healthy, so I wouldn't be, it would have been better than, PRP would have been better than non-PRP, for sure. You know, and as I said, I know, particularly in Columbus, a lot of surgeons are doing PRP with their surgery now, which is really cool.
Would it be helpful for her now? I mean, she's having trouble.
Come in, let me see what it is. You know,
They told me in post-op with her that she's gonna eventually do it.
if you have meniscus surgery, to take a bunch of meniscus out, you're gonna have to do stem cell replacement sometime, because they take out the cartilage. So, if we do, 95% of our knee procedures are people that have meniscus.
So it's all like
Because in my family, I had, the medial and lateral focusing trim.
So you probably don't have a whole lot of space.
Yeah, some of the regenerative
Wow.
stuff.
I mean, and looking at the pictures that he showed me, it's like, showing me the pink of the white area that was like, yeah, he's like, you don't have to. It's like you have something to regenerate from at the hospital.
You will probably need stem cells. I wanna see it though, 'cause I don't wanna tell you that, you come in, maybe it's not that bad, maybe I'm like, hey, you know, let's do this first. Because ozone, remember, ozone gets your own stem cells to produce. You know what I'm saying? So I'm thinking with your age, ozone's probably better than PRP, just because, you know, you're my age.
Yeah, well, we got a pretty strong hold on.
But is it, but are you, or maybe it's fine and you just have some type of tendinosis and maybe a shock that would be good, I don't know, like, we have to see what's going on. I wanna see a picture of it. I don't think you're, that's not that bad. And then, are you guys on hormone, I mean, and are you guys still, how are you guys hormonal? Because if you've been through menopause, you're not producing estrogen,
Right.
you got,
She had, yeah, she had.
yeah. If you're not through menopause, you're probably fine, but if you've been through that, then every girl's crazy not to be on hormones. Crazy. As long as they're bioidentical, as long as they're
Guys
bioidentical.
too, that happens with guys too, 'cause I don't-
Big time, but if you had to ask me, everyone should, they're crazy not to. But if you had, what's more important, it's more important for girls, because women need estrogen, okay? And if you quit producing estrogen and you don't take estrogen, your receptors shut down and you never come back. You can give me an 80-year-old guy, put him on testosterone and respond like that. Testosterone receptors never shut down. Estrogens do. So you give me a 70-year-old woman who's never gone on estrogen, I give her estrogen, she'll never get back to
Now,
estrogen.
no,
You were off of it for a year.
You could fly down there.
That's fine, we're talking about, 20, 30 years, like, it's still better than nothing, but it's not gonna be as good as if they'd gone on it right afterwards.
See, I noticed since
I
my
mean, that's
first
why
started
you're seeing a lot of the athletes for a while.
I used to be really athletic, really, in shape and all that, and
as I get out of bed,
And now it is, obviously.
Well, remember, so
But yeah, the insurance.
your hormones control your remodeling system. So basically, what your remodeling is like when you come here tonight to this seminar, you have someone at the house who's painting, filling cracks, and doing whatever. That's how you always regenerate yourself. That's all hormones. So if you don't have hormones, you're not going to regenerate. Now, if you're bone on bone knee, hormones aren't going to fix that. But they'll make what we fixed last long. If that makes sense.
Now, do you guys check for hormones?
Just do blood work, and it's either an issue or not. The blood work never lies. You know what I'm saying? So come in, do blood work. Hey, you're good, or no, you're.
And does your family doctor check for you?
They haven't been trained on it. I mean, we've been through I'm diplomate certified, so that's like the highest level of training.
So when you draw blood, you run different tests than the standard CBC?
That's useless for what we do. I mean, we do a CBC metabolic just because, but you want to see testosterone, estrogen, DHEAS, growth hormone. Those are the things that control healing and what anti-aging is. And those are all things that would affect your healing. Vitamin D. 100%. That's what I'm saying. Every woman, in particular, if they've had a history. Yeah, my mom's on it. My wife is a breast cancer survivor. She's on it. So you're crazy. I don't care what your health history is. Knowing what I am, guy or.
Okay, so you don't provide hormone replacement therapy through your practice does do hormone replacement?
Because we look at the body as a whole.
Well,
Anyone who's treating pain, if you don't look at hormones, you're not looking at the whole puzzle.
So
You know what I'm saying? That's how we got into it. You know, we started out just doing chiropractic, physical therapy, medical. There were some people that weren't getting better. No matter what kind of procedure we did, they weren't getting better.
Right.
If you don't have estrogen, you don't have testosterone, if you don't have growth hormone, I don't care what we do, you will not get better.
Okay.
You might get better for a little bit, and the same injury's gonna come back.
Yeah.
Every single time.
And then
That's-
your blood work, so like if I wanted to consider PRP when I'm over 60, you would do blood work you can do blood work to determine the viability of my stem cells before we made a decision on
What's your injury?
knees. There was a torn meniscus that had surgery in 08, and the knees bother me now. And then I was going to ask, the other question is, what can we do for luxating patella?
Luxating patella is usually a weak medialis, so I'll tell you some exercises to do. So basically what happens is this muscle is weaker than this, so it's luxating lateral.
Right.
So the surgery for it is this dumbest thing ever. They cut the muscle here, which makes no sense.
When I was having the physical therapy, when I was having the PT for my torn meniscus, you know, and I said something to him, the therapist, about, well, I have a luxating patella, should I consider it? He goes, no, don't do that, you know.
That's a muscle issue. You gotta strengthen your medialis.
My wife has that.
Huh?
My wife has that. She got those like special ankle weights that she uses.
Yeah, if you straighten medialis, it's a non-issue.
Oh, okay.
So, but that's something we show you do. You do it at home.
But if your knee hurts, obviously that.
Well, yeah.
But usually if you have that, you're gonna have patellar tendonitis underneath the kneecap, which can make training difficult. And that's something I keep talking on. That's like usually a good shockwave thing.
Pardon?
That's usually like shockwave would be better for that than PRP.
Okay.
If that's, once I'm diagnosing you, I mean, touch your knee, I'm just like.
Right, no, I
My brain
understand,
does
you're
this
throwing out, right.
You get a lot of knees here. A
So are
lot.
you an orthopedic doctor?
Yeah, physical medicine. So, but it depends, so X-ray.
Oh, yeah, obviously.
Yeah. And just see what's going on, that's the best way. And knee, like I said, knees are easier. If you have a back, we'll do a workup on you, there's a possibility we might want an MRI though.
Well, I've had a hip issue, an SI joint. I guess it's slipped. But every now and then.
Oh yeah, you did.
A lot of times, just straight chiropractic works.
Pretty much any other questions can be answered in.
Oh yeah. We do these all day long. Yeah.
This is why
I would say I can answer. I'll
Yeah.
be the
There's a
one
guy
doing
that came in for
consult, so
work
I can.
who
Anything
spoke all
else
this
you
great
have
stuff.
question wise, I can help you with.
And we do a lot of stuff in the office.
So he spoke.
You know, sometimes people
right
come
to me
in for
like,
thinking
you
they
know,
need
like, oh my
one
God,
thing,
this
and it
guy
turns
can
out
help. So I go down there.
you
and
don't. This will help
I
you.
know,
And he
I
put me
need
on a month-to-month, 6-month program, paying him
can bring it to the office.
Yeah, well,
Yeah.
that's
I mean, we don't, we have
Well,
the
actually,
pants.
we've been to your office
Like,
once.
I don't
We had
even
a
know
Groupon
whatever
for,
stuff you want.
depressure
Oh, he wanted me to buy.
Oh, yeah, that was probably the old owner.
That probably was a
Yeah,
while
the
ago.
old owner of the office, he actually passed away.
Oh.
And then we
No,
took.
it's been years.
Yeah, because we don't do
Yeah,
Groupon
I thought
anymore.
that was, cause,
It was
I mean, we
seriously
see
like
a,
herd
we
cat.
see a
Did you get adjusted?
chiropractor
There was.
once a week.
If you already
Oh,
did it,
okay,
didn't work
cool.
out, then maybe it's
Yeah.
not.
Down in different heights once a
Sure,
week.
yeah.
But at the same time, there's still some, you know, that's
Oh, we
not
get that all the
like-
time.
We usually do it
Like
once a month.
If we come in
If you
and
give
that's
me their
something you need,
information,
and you
yeah,
already see a
information,
chiropractor, check off that list,
Uh,
okay, what else?
You can
So,
just,
yeah, it's not like,
call the
Well, I mean, yeah,
office
and
or
my
give-
husband's just
are you coming
feeling
in?
so bad, and it's like, you know, now
No,
it's
but I would tell her.
you know, his headquarters on shops.
Hey, Travis.
Oh, really?
Get her information so we can talk to her
You know,
friend.
and it's
So
not-
then that-
I
and
know
then if
people
you- if
do
it's
that
okay
to
with
buy,
you,
but
Yeah.
I mean,
I'll get
it's,
ahold of you to get
it's
ahold of
just
her and I'll just call her.
Well, I know, and I'm still trying
She
to push
wouldn't
him,
have
well,
us.
Men
he's
are hard.
starting to get a
really
little
into
more
nutrition
open
and health and
Oh, cool.
that kind of thing, and she wanted to learn.
Oh.
self-healing and
Oh.
alternative
We do these
stuff
once a
and
month,
that
I
sort
can
of
be
thing,
for
'cause
the
he
next
used
one,
to
but I'll,
be-
we'll invite
When
her.
we were first
Yeah.
married,
Cause she's
His
the one that
attitude
told me, you don't wanna have
was
surgery.
if you went to
Only
the
if you don't
doctor and
have
you
to,
didn't get a
yeah.
shot,
Yeah.
obviously something,
Awesome.
you know,
yeah.
obviously something
Yeah.
was missing, so his
Yeah.
kind of attitude
Well, I
was
tell you,
you
I
needed
did
a
it.
shot for everything.
I tell everyone,
It's
like,
like,
in
and
my
I avoid
office,
everything.
I did the test, I did
Nice
the
to meet you.
hormone replacement in our office, and I'm 42 years old, work out,
I was thinking of my
eat
mom
healthy
too.
and stuff like that, and I did it just for a screener, and my testosterone was borderline dangerous. I was like, whoa, like,
But I mean, he's
Whoa.
feeling really bad. He has now, granted, back in '86, he was diagnosed with the, it's called a
she's in Phoenix, so she's in chronic care.
yeah,
you know,
You
and.
can look at it and see, is it
I
a,
can
is it a hip
feel-
joint
Yeah.
issue, is it
It's,
just
I've
like?
got it a little bit right now, he must have it a lot worse, cause I
See,
always
she
know
could have a joint issue, or maybe it's
she
just,
has, that comes and goes thing, but, you know, from eating right and doing, but when I get the swollen glands and I get the sound sensitivity,
okay,
then I know that it's flaring up.
Yeah.
Those are my symptoms.
I mean,
okay.
Is sound sensitivity is one of them, but I
Put
don't
her
know
through that.
the rest, you know.
And we,
she
we're
wouldn't
big
heal well, you know what I'm
proponents of
saying,
the,
it's just.
the hormone, the blood work, and
If you
stuff. I
get
mean, I had this
something,
lady that I was
is
working
that
on,
healing? They're like,
it just,
probably should
yesterday,
take those screws
And
off.
you're doing the true bio.
we're trying
go back
everything
and
on
down.
her, and she just wasn't healing.
Maybe she just has some
She wouldn't
neurogenic
do-
pain that.
She wouldn't
you
do
know,
the
goes over.
hormone replacement, she wouldn't get checked for it. I kept telling her,
Which is
and
pretty
finally
old,
she did it, and,
You know what I'm saying?
her vitamin D was the lowest I've ever seen.
Well, and I'm originally-
And maybe stem
It was
cells,
like-
if it's the
It was
cracks.
like non-existent,
Stem cells.
that'll change your life, you know how
But it
cheap
doesn't
vitamin D is?
follow.
You get it everywhere, but
Well,
she needs.
We have to have an x-ray, you can see the
She went
x-ray
off
will
the
tell us,
counter
because a
to
lot of times it'll
get
be
it.
the joint with the pain
what do
on
I
the
know,
side.
and, you know, it's not necessarily.
Yeah.
You know what I'm saying, because that could work out too.
Sunscreen, all I hear about is people getting skin cancer.
Vitamin D is really bad
And the
in
vitamin,
Ohio.
the lack of vitamin D.
Yeah, so just,
Well, I'll see you
just
guys
to
when
let
we
you
come
know, like, the proper amount of
Just give it
vitamin D
Travis.
naturally,
Yep.
in Ohio, you have to have, I think it is at, 60% of your skin exposed to direct sunlight,
Right.
which is the definition, your shadow can't be longer in your body
Right.
for 4 hours a day.
Oh, 4 hours, I thought it was. And
Yeah.
then they're saying,
And,
oh, you just.
well, that's in Ohio.